Good morning. My name's Ross. I'm a nursing student. I'm going to be following you today. Can you give me a S bar on this patient?
Hi, Ross. I'm Laura. I'm a real nurse, and absolutely. Our patient is Shanana O'Connor. She's a 34-year-old female. She's in room 231. She has an allergy to sulfa, which causes a rash, and she has a full code. She currently is being followed by Dr. Engelbert, and she's on a renal disease diet with 500 milliliter fluid restriction, so we have to monitor her INO. That's really important. She came in with fever, chills, and general malaise. She is a type 1 diabetic since 8 years old. She does currently have renal end-stage disease for 1 year. She is on hemodialysis 3 times a week for the past year, and she's also on the list for a kidney transplant. Within the past month, she's reporting increased glucose levels. Usually, usual doses of insulin are not controlling her sugars as well as it used to. She's also complaining of decreased appetite with minimal urine output. She's calling it a dark and more concentrated urine. She's noted a weight gain of 10 pounds, which is pretty significant, so we want to make sure that, try to find out what's going on with that. She denies any swollen lymph nodes. Previous illness, she's had a graft infection from her shunt about 3 months ago, which resolved after IV antibiotics, and she does have a history of recurrent UTIs. She has renal failure secondary to diabetic neuropathy. I can't talk today. And she also has hypertensive nephrosclerosis, so she does have some damage from consistently high blood pressure readings. Her vital signs are heart rate of 108, respiratory rate of 20, O2 stat of 97, excuse me, I'm losing my voice. Blood pressure of 138/78, temperatures of 109 Fahrenheit in the mouth. Pain was reported about 2 hours ago at a 4. She was given some Tylenol, so we'll have to inquire and see if that has come down any at all. Her weight is currently 177 pounds, and she's alert and oriented times 4. The physical exam, the skin is warm, intact with mild diaphoresis, which could explain why she's not feeling so hot. She has an IV in the right median vein. She denies any pain currently, difficulty urinating in regards to her urine. She does have some numbness and tingling in her lower legs. Her AB graft looks good. It's pink, clean, intact with bruit and thrills, so we know it's working properly. She does regularly have tachycardia with a regular rhythm, so we don't have to, that might just be a part of her sickness process, the infection process. There's the word I was looking for. She does have slight pitting edema in bilateral lower extremities. Current meds from home is calcium carbonate, renal multivitamin, aspirin, clonidine, insulin, erythropoietin for dialysis, atorvastatin, and we're going to be giving her imipenem cilastatin, which is a new antibiotic for her. The doctor requested IV antibiotic therapy because of her history of recurrent UTIs. And then we're going to start her on some normal saline. We're going to keep it at a restricted fluid volume because she does have renal failure and she does have a 10-pound weight gain. So we do want to not go full bore. We're just going to give her 30 milliliters an hour. We're going to continue with her dialysis. That's what I'm going to recommend. We're going to continue with her dialysis to make sure that it's removing the antibiotics from her body since her body can't do it for her. We need to assess her IV site. Make sure there's no signs of infection there. I need to pick up her urine sample before we start the IV antibiotics because once you start the antibiotics and get a urine sample, it's going to defeat the purpose.
Okay.
We want to do her IV saline and her antibiotics, and then that's going to go over 30 minutes. It's going to be a piggyback over 30 minutes, and then her IV fluids will go ahead and continue. And hopefully that will help with her urine output and help increase that. She is doing the dialysis, so it could go either way. We want to educate our patient about her new medication that she's going to be receiving, which is the antibiotics, make sure that she understands about what the medication is going to cause and any sort of side effects that may happen during receiving the medication. We want to make sure that we continue to monitor her daily weight because she does have that 10-pound increase. We want to monitor that in the morning with the same scale, wearing virtually the same clothes prior to eating. And we want to monitor her kidney function throughout the entire process because she does have some decreased kidney function. And then we want to continue to monitor her blood glucose because her last reading at 1745 was 210, which is a little high. She does have, she is stating that she's having some social withdrawal. She did have a lot of friends, and since her illness has happened, her friends have kind of dwindled off a little bit. So we kind of want to check in on her and see what other kind of coping mechanisms she may have. Do you have any other questions for me?
Yeah. Why specifically is the client receiving this medication?
She's actually receiving 2 medications. Fluids are considered a medication as well. So the fluid we're giving to maintain her balance of fluid and electrolytes, it's called an isotonic fluid. Have you been taught what that means yet in level 1?
I have.
So you know it's an equal part.
Yes, Miss Morris taught me that well.
Equal balance. Miss Morris, she's a great teacher. She was my teacher as well. Because we want to give her fluids because she does have a slight fever and we decrease her urine output. So we want
Okay.
to try to keep her without an electrolyte balance. We don't need to add that to it. The antibiotics she's receiving because the doctor is suspecting another urinary tract infection. So he's ordered IV therapy while ruling out bacteremia or UTI because she has a elevated temperature with chills, and she reports a decreased frequency and volume of urine output, and that her urine has become more concentrated. However, she does denies pain, or difficulty with the urination. But the doctor's ordered it, so we got to follow his rules. And then her elevated blood sugar could also be an indication of some sort of infection process happening within her body as well.
What action does the medication have on the body? Sounds like you kind of answered that for me.
Basically, it just inhibits bacterial cell wall synthesis, killing the cells off, killing
Okay.
the viruses or bacteria, not virus. Antibiotics do not kill viruses, they kill bacteria.
Okay. When should you question administering the medication?
It is contraindicated in people with obvious allergy to that particular medication.
Okay.
However, you do want to make sure they're not allergic to penicillin because there could be a cross sensitivity there with that, as well as cephalosporins. But she's only allergic to sulfa drugs, so we covered that one. In regards to the fluids, you want to check for fluid overload, so crackles in the lungs and edema. And then you want to make sure, again, if you want to check for seizure disorders, renal impairment, but she is receiving hemodialysis, so we can kind of adjust the dose accordingly for the renal impairment.
Okay. Does this medication have a therapeutic serum level?
It does not. It ends. There is no peak in the end of the infusion. I cannot talk today. I'm sorry.
That's
Ross.
okay.
The end of the IV infusion. The peak is at the end of the IV infusion, and it stays in the body for about 6 to 8 hours. So that's why we're doing it every 8 hours.
Okay. So which vital signs should be monitored?
The standard answer: all vital signs should be monitored. However, you want to check her creatinine BUN levels because she has end-stage renal disease.
Okay. And which physiological parameters should be monitored when the medication is being administered?
Because this is it's used this medication is used with caution in patients with renal disease. So we want to make sure that her hemodialysis occurs within 48 hours of receiving that medication to prevent buildup and toxic levels of the medication within her body.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to advise the client of signs and symptoms of a superinfection because this is a broad spectrum bacteria, so it just kills off everything. So we want to have her on the lookout for a black furry overgrowth on the tongue, vaginal itching or discharge, loose or foul smelling stools, any sort of anaphylactic reaction, swelling of the airway, rash, itching, that kind of thing. We have to tell her, we have to have her notify the healthcare professional if she has a fever with diarrhea, and she's also not to take any sort of antidiarrheals without notifying the physician first, especially if her stool contains blood, pus, or mucus, because C. diff is also, there's a higher risk for C. diff with this type of medication as well.
Okay. What interventions must be taught for taking the medication safely at home?
This particular medication is only by IV or IM, so she probably would not take it at home.
Okay.
And if she did, she would probably have home health come in and administer it to her. But again, it would be the same thing. Just keep out for signs and symptoms of C. diff, superinfection, anaphylaxis. Seizures is also a pretty big side effect on this one as well.
Okay. And so what are the side effects and potential adverse reactions?
Oh, I already answered that on
Yes, you
accident.
did.
Whoops, sorry.
How will you know the medication is effective?
The resolution of the infection. Her fever will fever will go away and the resolution of the signs and symptoms of the chills and malaise.
Okay, that's all the questions I have. Maybe we could give this medication.
That sounds great. Let's go in and do it. Knock, knock.
Come on in.
Hi, Miss O'Connor. I'm Laura. I'll be your nurse for today.
You can call me Shanae.
Oh, Shanae, that's a beautiful name. I haven't met too many Shanaes in my life before. This is Ross. He's my nursing student. He's going to be observing me give you the medication. Is that okay with you?
Yeah, sure. Here, I peed in this for you.
Oh, awesome. Thank you. Let me put some gloves on. Let me wash my hands and get some gloves on. That's great. I'm glad you were able to give me a urine sample this time because I know you were having some decreased urine output.
Yeah, it's just a little bit, but hopefully it's enough.
It'll be perfect. I appreciate it. Okay, can you verify your name and date of birth for me, please?
Shanae O'Connor, 34.
That's great. Thank you very much. And then, do you have any allergies that I need to be aware of?
They said I was allergic to sulfa something or another.
Sulfa medications?
Yeah.
Okie dokie. And then we are going to be giving you some IV fluids as well as an IV antibiotic. The doctor wants to start you on antibiotics.
Oh, okay.
Have you taken this kind of medication before? It's called imapentine Silastatin?
Yeah, I think
The
so.
IV medication?
Yeah, I think so. I don't know. I've been in and out of hospital so much.
Yeah, that's hard. Yeah. So I'm just going to give you a couple things you need to keep your eye out for. Any sort of airway swelling, itching, anything like that, you need to hit your call button and notify us immediately.
Okay.
And then we also need to inform you of side effects of the medication, which could be, it's a broad spectrum antibiotic, so it kills off all the bacteria in your body, including good bacteria. So that leaves you more susceptible for things like C. diff and a super infection.
Oh.
Yeah. So you want to keep an eye out for things like a black hairy tongue. Yeah. Isn't that good stuff? Black hairy tongue, vaginal itching, discharge, which could indicate a yeast infection. You're
Okay.
very silly, Ms. O'Connor. Shanae. And then if you have any loose, foul-smelling stools, bowel movements, with your fever, you need to notify us as well. You also should not be taking any sort of antidiarrheals without notifying your doctor. Okay. Here's some information on the medication, on C. diff, as well as super infection. I'm going to leave this with you as well, and then we're going to go ahead and get you started on your medication. Oh, go ahead and take your urine sample now. You don't need to hang on to that any longer. Okie dokie. So we are going to start with saline, which I don't have. Where did that go? Oh, here we go. Found some. It was in my bag. Right here. Right here the whole time. So Ross, have you done any IV stuff yet, or what do you learn in level 1 for IVs?
We learned a lot about Florence Nightingale.
Florence Nightingale, she's a saint. That lady's great. So you haven't learned anything about IVs yet?
Not
Florence
yet.
Miss Nightingale? Okay, so fluids will be the primary, meaning that it's going to be the first one to go through. And then once we hang this piggyback, the piggyback will take over and the antibiotics will be distributed first, and then the secondary, and then the fluids will continue to push in.
Gotcha.
So this is just going to help hopefully increase some of that urine output there for you and help make your urine a little less concentrated than what it's been.
Good.
Going to scan your wristband here. Can you tell me your name and date of birth one more time for me,
Shanae
please?
O'Connor, 34.
Oops, I did that wrong. Check it. Click on the medication first. Got to click on what you're given before it'll do that. There we go. These computers.
Click it before you stick it.
Back in my day, we had to write everything down, Ross. I've been a nurse for a really long time. Perfect. Then we're going to scan in her medication, which is this one. Maybe it'll scan today.
Beep.
Uh-oh.
Uh-oh. Well, it's not scanning today. That's good.
You can manually do it.
Here, we'll give you your antibiotic first.
This one's scanning.
There we go. Okie dokie. think my barcode's too small. Okay, well, we're just gonna give you this. I'm gonna give you this, and then we're gonna keep going. Okay, so the first thing you have to do is prime the line. When you prime the line, you wanna make sure there's no air bubbles in your line. So you hang it up because you don't want it hanging on the ground. And take this blue thing off, you don't need that, that's just there for looks. And then there's a little thing that you pull out there. You want to make sure that the piercing spike stays sterile, don't touch it, not for hands. Put your bag on, make sure your roller clamp is closed, because once you open this baby up, it starts flowing fast. Then you hang your fluids. You want to fill the drip chamber halfway, just to make sure that you can get some fluid going through there. Then you, as I say, let her rip. And then just go all the way down until you see some drips coming out the end. Maybe. Oh, there we go. Gravity works against you sometimes. There we go. And then as it goes down, you just want to watch it to make sure there's no air bubbles going in, because you don't want air going into your patient. That's dangerous. And then you close your roller clamp so that it will stop running. And then once that's all primed up, we want to go ahead and program our pump. There we go. Maybe. There we go. Machines are weird. And we want to turn it on, because it doesn't work unless you turn it on. Okie dokie. And then this is a new patient to us, and we are in the med-surg area. We want to put in her name. So, O'Connor. This would be easier if you could just scan her in. They really need to work on that kind of technology. Okay, and then we confirm that is the correct patient. And then you want to tell me your name and your date of birth again for me, please?
Shanae O'Connor. I'm 34.
34, that sounds great.
Oh,
And then do you have any allergies?
those sofa things.
The sulfa things? Those that hasn't changed?
Nope.
Perfect.
I guess not. That's just what they tell me.
Who told you, your doctor?
Yes.
Perfect. And then we want to channel select, basic infusion. And then we're going to do a rate of 30 milliliters per hour because of her kidney function. And then the volume to be infused, it is a 1,000 milliliter, it's a 500 milliliter bag, but we're only going to do 450 because we don't want the tubing to run completely dry. That could cause a problem. And then I'm going to verify my 30 milliliters an hour with my MAR, 30 milliliters, already confirmed with the patient. I'm going to check her IV site. It looks great. It looks really pale. And then I'm going to clean the IV site. And then because I didn't take the cap off, this is still sterile. So we want to take this part off, maybe. Ooh, it's exciting. And then you want to connect those two. And that's great. Hold your IV site for me, Miss O'Connor. Thank you very much. And then press start. Open your roller clamp. That's really important. It will not go through if your roller clamp is closed. And then we're good to go. You want to watch for 5 drops. Make sure that it'll go through. And then we're good to go. And then we're going to scan her other medication. Why is it? Okay.
No occlusions.
It says it's occluded. And then we're going to go ahead and give her antibiotic right now for the piggyback line. So we're going to scan this one in. And then we're going to ask her name and her date of birth again. Can you tell me your name and your date of birth, please?
Shanae O'Connor, 35.
Bye, gloves. We're going to scan the patient again. And then I'm going to verify my order. I'm a Penem Silastatin.
What
They
are
really
you?
don't make these very easy to say. And it never gets any easier, Ross. It stays this difficult always. Those those generic drug names, they sure don't make them easy.
I think that's a rap song.
Generic drug names, they sure don't make them easy? Yeah, probably. Okie dokie. And then we're going to attempt to open the secondary thing. Here we go. Sometimes you got to cheat and use scissors. You got to admit your faults. I'm not strong. Admit them.
You're strong on the inside.
I am strong on the inside. And then when you hang a piggyback, you hang your primary lower so that gravity takes over. And the antibiotics go in first because we want those to go first. And then you have to prime the line again, which is the same process that we just did with the other medication. Fluids. Fluids are medications. Rossford,
Yes.
did you know that oxygen is a drug?
I did not know
Isn't that
that.
insane?
That's pretty
It's
weird.
crazy.
It's pretty neat.
Yeah. And then you hang it, and then you want to do the same thing that you did before. Run the line, make sure there's no air bubbles in it. There we go. Ooh, we're flowing. Thing about the secondary line is the bag's usually smaller, so it takes next to nothing to get it going. Then you want to clean your site because this has been exposed to the air, so you want to make sure it's nice and clean. I didn't take the cap off, so this is still sterile. You want to attach that there. Did that. And now we have to go back and do our secondary infusion. So we look through the pump for imipenem cylostatin.
I'm a pen.
And then here's her dose right here, 500 milligrams. The pharmacy was kind enough to reconstitute it and put it in this bag for me,
Right
so
on.
I don't have to have the risk of a medication error. And then this medication is going to be delivered. Okay, it's asking me to double check it again, and yes, it is correct. I'm checking it with the MAR. That is correct. So yes, that is correct. It's asking me a third time because they really want me to make sure that I am getting 500 milligrams, and that is correct. So press next to confirm. And then I'm going to give it over 30 minutes. And then I'm going to double check it one more time, make sure that I'm putting the whole correct information in there. That's not a word. And then I want to make sure that the secondary roller clamp is open. And then I want to press start. Okay. And then we are all good to go. It's very important that you check your drip chamber for 5 drops before leaving the patient's bedside. 2, 3, 4, 5. Okay. And then we can ask the client if she has any further questions. Do you have any further questions for me?
No, I'm great. I'm
Perfect.
Good.
So we will come back in about 15, 20 minutes to double check in on you. If you have any of those symptoms that I was explaining previously, any sort of airway swelling or itching all over your body, hit that call light and we'll come running on in.
Okay.
Okie dokie.
Sounds good.
Perfect. I'm going to take my gloves off and wash my hands. I'm going to check the IV site, make sure there's no swelling, make sure that the IV is flowing properly.
Feels smooth as butter.
Smooth as butter. That's great news. That's great news. And then I'm going to document that I gave the medication through her IV site and that patient tolerated it. No adverse reactions, no redness, no swelling, no infiltrate. And then we are going to step out of your room and get out of your hair.
All right. Get on.
Ooh, maybe
You can get out.
if I can get out. These
Crazy wire.
don't make these wires too long. Okie dokie. Do you have any more questions for me, Ross?
Yes. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, because she's on dialysis and this could have some renal issues for her. We wanted to make sure that she was getting her dialysis within the 48 hours. We also wanted to make sure that she did not have an allergy to penicillin because, like I said before, they could have that cross issue, the cross sensitivity issue.
Okay. Did this information affect your decision to administer the medication?
No, not really. I mean, we would want to call the physician if she wasn't receiving her dialysis within that 48-hour period. But other than that, no.
Did this information affect how you administered the medication?
No, the medication is only administered IV or IM. The IV site was patent, so it was acceptable to administer the medication through IV.
That's all the questions I have. Thanks.
Thank you so much,
I learned a
Ross.
lot.
Have a good day.